Hello, everyone. As you get signed in, you will see a poll on your screen. If you could take a minute to fill it out, that'd be great. You can also drop into the chat where you're calling in from today. And while we wait, I would like to introduce myself. My name is Madison Burnett, and I'm a BCBA. I lead our professional development program, and I'll be supporting throughout the webinar today. In addition to that role, I work alongside other BCBAs on our clinician-led recruitment team, and I support in the effort of recruiting quality professionals to join our team. If you are interested in joining MPG, please indicate so in the post-webinar survey at the end of this webinar, or you can email careers@manhattanpsychologygroup.com. I'd also like to tell you a little bit about Manhattan Psychology Group. We were established in 2011, and we've continued to grow our team consisting of skilled adult and child psychologists, neuropsychologists, behavior analysts, special educators, licensed social workers, and ABA therapists. As a team, we're committed to wraparound care, which includes our wide range of services from mental health and testing to educational services. This holistic approach allows us to address various needs and challenges with compassion and care. We provide services to clients out of our Upper West Side and Long Island City offices, in home, school, and clinic-based settings, as well as through telehealth. Our team is committed to serving individuals, couples, and families of all ages in diverse settings. We're also pleased to offer these free monthly webinars for parents and professionals where we will continue to learn and foster meaningful connections. Our vision at MPG is to create a future where individuals and their families feel supported, connected, and empowered. And our mission is to provide multidisciplinary, integrated support for individuals and their families who experience mental health, behavioral, and educational challenges. In an effort to stand by our mission and vision, we are thrilled to offer these free 20-minute phone consultations with our clinical team. You can schedule a time by visiting our website at www.manhattanpsychologygroup.com, or you can follow the link that I'll be putting in the chat momentarily. And now for some housekeeping information. This webinar is eligible for contact hours for New York State licensed psychologists and social workers. A link for the quiz regarding the content of this presentation will be posted in the chat and on the calendar within the last 5 to 10 minutes of the presentation. As of January 1st, we have started charging a nominal fee for the continuing education certificate. This webinar is still free to attend, but to receive a contact hour certificate, it is going to cost $10 for psychologists and $5 for social workers. Any polls during this webinar are not required to get your certificate, but they are encouraged. We will be sharing the slides and the post-webinar email that is sent, as well as on our calendar. Today, we'll be leaving the chat open, but please post any questions you have in the Q&A so we can make sure that they are seen. If there is time at the end of the presentation, Jennifer will be answering some of these questions. And now I'm excited to introduce today's speaker, Jennifer Shindman. Dr. Jennifer Shindman is a New York State licensed psychologist. She has experience working with children, adolescents, adults, and families in various settings, providing individuals, group, and family therapy. She has worked in community mental health centers, outpatient hospital settings, and in schools. Dr. Shindman has treated clients who have a wide range of emotional and behavioral disorders and presenting problems including anxiety, depression, anger, ADHD, trauma, poor self-worth, perfectionism, and disruptive behavioral disorders. In addition, Dr. Shindman ensures that her clients feel safe by creating a warm, supportive, and non-judgmental environment. She uses an active, direct, and goal-driven approach to help her clients identify why they may be struggling, and then empowers them to make necessary changes to better manage stress and live a more fulfilling and meaningful lives. And now, without further ado, I'll hand it over to Jennifer.
Thank you. Thank you for the introduction. I am excited to be presenting to all of you today. Just a little bit of an outline for what to expect. We will be talking about everything ADHD. We will cover symptoms, risk factors, the impact of ADHD on functioning, the brain, and ADHD, what ADHD looks like across the lifespan, how to assess for it, and then with this understanding, how to best support children with ADHD at home and at school. And we will also be reviewing some evidence-based programs and some resources. So what is ADHD? It is a neurodevelopmental disorder, meaning that it impacts the development of the brain, resulting in patterns of inattention, hyperactivity, and impulsivity, and it is usually diagnosed in childhood. As far as how common it is and the prevalence, we see ADHD in about 9 to 11% of children, and it is diagnosed more often in boys than girls. But as into adulthood, we see this gap close, and the diagnosis rates are about similar for men and women. As far as symptoms and diagnostic criteria, there are 3 presentations of ADHD. You have the predominantly inattentive type, the predominantly hyperactive impulsive presentation, and the combined presentation. And if you're diagnosed with one at one time, it doesn't mean that there's some variability there. The diagnosis presentation can change over the course of the disorder. And so we have the symptoms must be present for a diagnosis at least for 6 months and before age 12. And very important, they must occur in 2 or more settings. And the presentation of ADHD could be mild, moderate, or severe. And just a few examples of some of the symptoms. So for inattention symptoms, we're looking at things like difficulty sustaining attention in tasks, being easily distracted, being forgetful, losing items. The symptoms of hyperactivity, impulsivity presentation look like not being able to sit and see when you're expected to, difficulty playing or engaging in activities, blurting out answers before the questions are completed. And again, the combined presentation is the combination of those 2. As far as risk factors for ADHD, research shows that ADHD is influenced by both genetic and environmental factors. ADHD has a strong genetic component, meaning that it often runs in families. And studies show that if one parent has ADHD, their child is 50%, has up to a 50% chance of developing the disorder as well. ADHD has also been linked to maternal use of alcohol and drugs like cocaine, as well as premature birth and low birth weight. In childhood, head injuries, TBIs, lead exposure can also contribute to attention difficulties and diagnosis of ADHD. So ADHD is associated with both structural and functional differences in several brain regions that are responsible for attention, impulse control, and executive functioning. Neuroimaging studies have shown that these areas tend to be smaller in size and have reduced or variable activity. And in addition to that, they also showed delayed development by approximately 2 to 3 years compared to neurotypical brains. There's evidence showing the brain size might normalize in adolescence, but the functioning, the variability in functioning does not, and that continues to be there. Some key brain regions and what they're responsible for. We have the prefrontal cortex. This is the brain's control center for executive functions like impulse regulation, working memory, and attention. We have the basal ganglia playing a crucial role in motivation and reward processing. The anterior cingulate cortex, responsible for error detection and emotional regulation. And the cerebellum is now known to contribute to cognitive processes like timing, coordination, and planning, all areas impaired in children with ADHD. And there's something called the default mode network, which is typically active in the brain when the brain is at rest, and then it deactivates when focus is needed. But in people with ADHD, this network remains overactive during tasks, leading to mind wandering and difficulty sustaining attention. Some neurotransmitters or neurochemicals, dopamine and norepinephrine, and dopamine is seen as the fuel for motivation, and norepinephrine is related to alertness and cognitive engagement. Now, ADHD is often called a disorder of executive functioning. Executive functioning can be defined as a set of mental abilities that's necessary for goal-directed action and self-regulation. These are the skills that allow individuals to control their behavior, manage their emotions, and adjust their actions or behavior to achieve long-term goals. I'm going to go through each of these and define them. So first we have inhibitory control. This is the capacity to think before you act and the ability to stop impulsive behavior and resist distractions. So what might this look like in a child with ADHD at home? You might see things like blurting out answers during conversations, interrupting others, having difficulty waiting your turn when you're doing family activities. In school, these are the kids that might call out in class without raising their hand, grab items without asking, or struggle to stop themselves from getting up when they're supposed to sit still. You see a lot of, a child with ADHD might get up and throw something in the garbage and then see something they like, and as they're returning to their seat, kind of get a little distracted and be doing that instead. Working memory. This is the ability to hold and manipulate information in the mind. It's holding information online while performing complex tasks. So Johnny has 6 apples, he gives Mary 3, then Devin comes along and takes 1 more. So you have to remember that information and perform a complex task or some mental operations with it. And people with ADHD struggle with that. That often leads to forgetfulness, difficulty following multi-step directions, and trouble recalling information when it's needed. So at home, if you ask your child, go upstairs, get your socks and come back, they might come back, they might go upstairs and say, what did you ask me again to do? Or they might just come back empty-handed. At school, this is a child that might lose track of what they're writing in the middle of a sentence or forget assignments. Cognitive flexibility or shifting or task switching. This is the ability to adapt easily and efficiently to new and unexpected conditions. People with ADHD struggle with transitions, making it difficult or challenging to adapt to changes in plans or switch focus between activities. And so at home, you might see a child having a tantrum or an emotional outburst when plans change unexpectedly, canceled play date. At school, child walks into the gym class thinking they're going to play their favorite game of soccer, and then the teacher decides to kind of change that and say, no, we're playing this instead. So there might be some difficulty there. Planning and organization, this is also a big one. Planning requires the ability to break tasks into manageable steps, create a roadmap to reach a goal or to complete a task. It also involves being able to make decisions about what is important to focus on and what's not, where an organization helps us keep track of materials and our responsibilities. Difficulties or deficits in this area result in procrastination, disorganized workspaces, and trouble prioritizing tasks. So for example, a child's room might be perpetually messy because they don't know where to start cleaning or the steps involved, difficulty with projects or homework. And so it's important to know that saying something to a child with ADHD, like get ready for school, it might seem clear, but if you really break it down, there are between 10 and 50 active behaviors that child has to do to make that happen. Even something like brushing your teeth, go to the bathroom, turn the water on, open the toothpaste, put the toothpaste on the toothbrush. And we often don't think about these mini steps within these bigger tasks, but these are the things that kids with ADHD struggle with. And if you've ever seen at school, talking about organization, if you've ever seen the book bag or the desk or the room or the binder of a child with ADHD, a lot of the time there's paper everywhere and kind of a lot of stuffed papers in book bags. Emotion regulation is the ability to manage emotions, to achieve goals, complete tasks, and control and direct behavior. And ADHD can contribute to heightened emotional reactivity, difficulty tolerating frustration, and difficulty recovering from setbacks, similar to that switching attention. And so you might see a child having extreme emotional reactions, like crying over what someone else might view as a small frustration. Self-monitoring or metacognition. This is the ability to be able to stand back and take a bird's eye view of yourself in a situation. It's how you evaluate your performance and then adjust your behavior accordingly. It allows you to reflect on your behavior and see how well what you're doing aligns with your goal. It's your ability to say, how am I doing with this? And so then if you're able to do that, that helps you then change your behavior, increase or decrease certain behaviors to then achieve that goal. And so kids with ADHD also struggle with recognizing mistakes, assessing progress, or learning from past experiences. Task initiation. This is the ability to begin projects in an efficient way without procrastination. Getting started on tasks, especially those that are uninteresting or effortful, can be a major challenge for people with ADHD. So for example, a child with ADHD might take a lot longer to start doing chores or homework and need repeated reminders. At school, you might see a child kind of with a worksheet in front of them, just kind of staring blankly at it, unable to begin without assistance or external motivation. Time management. So Russell Barkley, ADHD expert and researcher, talks about ADHD as a disorder of time perception, where people struggle with estimating how long tasks will take, how to allocate that time, and how to stay within time limits and meet deadlines. And so at home, a child might take an hour to get dressed in the morning because they struggle to kind of gauge how long that will take. And so if you think about if you combine the time management with the difficulty initiating, so it's the waiting the last minute, and then combined with the difficulty of estimating how long a task will take. And so we often see problems with lateness and things like that with people with ADHD. Goal-directed persistence. This is the ability to have a goal and follow through to the completion of the goal and stay focused on that task despite distractions or obstacles. ADHD makes it harder to maintain long-term effort and motivation, leading to unfinished projects and, again, difficulty sustaining attention on long-term goals. So even things that a child may have been initially interested in, you might see a child at home being very interested in a puzzle and then kind of giving up on it. At school, children might struggle to finish projects, especially when they require sustained effort and attention over time. So often, kids with ADHD, they know the right thing to do, and they may even be able to articulate that to you. But the ADHD brain creates a disconnect between the knowledge brain and the performance brain. Kids with ADHD struggle with applying their knowledge effectively in real life situations, AKA the point of performance. These are the critical moments when action is required, when you need to apply knowledge to a situation, whether it's completing a task, making a decision, or engaging in a behavior. People with ADHD, this is the point where they struggle. They might know the steps they need to take, but when the time comes to perform, they cannot act on that knowledge effectively. And so Russell Barkley, again, uses the term intention deficit disorder, and how that might be a better describe ADHD as the challenge and the real life damage comes from an inability to execute intentions, or as he puts it, an inability to persist over time to keep your actions towards a goal. People with ADHD often skip from one thing to another in short chains of actions, but they can't string it all together to sustain it over time to accomplish a goal. Again, as I mentioned earlier, it's important to remember that there is a difference between the actual age of a child with ADHD and their executive age. Meaning, a 10-year-old child with ADHD might have the executive functioning skills of a 7-year-old child. And so it is absolutely crucial for adults in the lives of people with ADHD to understand the disorder and its implications. In my work with parents, children, adults, partners of people with ADHD, I frequently hear phrases like, "We do this every day. How could he just not know? He should know better. Why can't he just do it?" I often hear words like lazy, doesn't care, selfish. And so, it makes me think of it. I worked with an adult client who had ADHD who was kind of on like a self-hatred spiral, just being really hard on herself, that she was late to work, something having to do with poor executive functioning. And I let this kind of spiral of self-hatred go on for a minute. And then I asked her, I said, "Okay, can you stop you for a second? Take off your prescription glasses and now yell at yourself for not having 20/20 vision and not being able to see the way that people do with perfect vision. What this did in this moment is it gave her pause and it helped her see that one, it's not her fault and it's not due to a character flaw. And then two, it helped to then shift from anger, blame, and self-downing to problem solving and intervention. When we get stuck in blame or anger of ourselves or our children, we are not doing what we need to do to solve the problem. We are demanding that the child change rather than modifying their environment and providing the tools necessary for success. We need to approach ADHD with the same empathy, understanding, and acceptance we would offer someone facing a physical challenge. Think of it as someone trying to run the race with an injured leg. They might want to finish first. We might really want them to finish first, but they can't. They need help, tools, and time. And when we understand ADHD in this light, it becomes easier to offer support and compassion instead of judgment. And this is a prerequisite. This understanding is a prerequisite for effective intervention. Okay, let's talk a little bit about ADHD across the lifespan. As I said before, ADHD presents in childhood, and we often see people coming into clinics for diagnosis and assessment once children start entering school. As children enter adolescence, symptoms persist. Hyperactivity can decrease, but impulsivity and inattention continue to be prominent. And a lot of adults even describe or adolescents like an inner restlessness. This makes the transition to adolescence difficult, given the expected increase in independence, academic pressure, peer pressure. Research also shows that progesterone and estrogen play a role in the severity of symptoms, and so we may see an increase in ADHD symptoms and executive functioning struggles in girls with the onset of menarche. And again, adolescents with ADHD are at higher risk for engaging in risky behaviors, substance use, driving, things like that. By adulthood, most people with ADHD go on to continue to have the disorder, but the symptoms, again, might manifest differently than they did in childhood. There's recent research from Margaret Shipley and colleagues that shows that only 9% of children in childhood fully outgrow the disorder, but the majority of the remaining individuals, they experience fluctuating symptoms over time, symptom levels rising and falling. Over the course of as they're kind of getting older. And this indicates that ADHD tends to follow a highly variable course throughout development. Many adults struggle with things like career responsibilities, maintaining relationships, and focusing and following through on long-term goals. And so as we take a look at ADHD across the lifespan, it's clear that it is not just a childhood issue, it's a lifelong problem, lifelong disorder with some serious implications. And to further discuss some problems that you might see, some health problems, obesity, binge eating, risky sexual behavior, STDs, more sleep problems, and kids with ADHD are, I think, 2 times as likely to die by accidental injury by age 10, and this risk goes up to about 4 to 5 times more likely to die by accidental injury in adulthood. They have social difficulties, so things like maintaining friendships, or there's poor family functioning, difficulty in romantic relationships, some more likely to be arrested, and antisocial behavior and activities. Remember this executive functioning age when it comes to driving. So the potential that you hand a 16-year-old kid the keys to a car can be like handing them to a 13-year-old. And as a whole, people, even adults with ADHD, there's more driving prior to getting a license, more accidents, road rage, more license suspensions. A longitudinal study from William Pelham found that by 30, adults with ADHD had lower incomes, reduced savings, and higher unemployment rates. And when it comes to education, we see more kids are at risk of repeating a grade, more suspensions, poor performance academically in school, and there's often a gap between intelligence and academic performance. And the longer the child does not receive support, the more this gap widens. I remember working with a 10th grade student in counseling during my internship years ago. And I guess for the first time, I was reviewing his cognitive scores and all the scores from testing, which he wasn't aware of. And his IQ cognitive scores a lot of them were in the 90th percentile. And when I described all this to him, his jaw was just wide open because he'd been failing at school for so long. And so again, that's the early intervention is really, really important so that we can provide the right kind of settings and environmental modifications. Employment, adults with ADHD often face difficulties with employment, more job instability, more changes, more often getting fired, more accidents at work. And so ADHD also coexists with other mental health disorders, and the research shows that 2/3, but this number is likely higher, closer to 80% of individuals have at least one co-occurring condition, and half have two. And so we'll take a look at some of the most common ones. We have oppositional defiant disorder. About 40% of individuals with ADHD also have ODD. And the more severe the ADHD, the more likely ODD is to develop. There's a little bit, follow me here for a second with the autism spectrum disorders. So about 20% of kids with ADHD have autism spectrum disorders. But if a child is already diagnosed with autism, there's a 50% chance or more that they will go on to develop ADHD. And so the risk depends on which one is diagnosed or developed first. We see 20 to 25% of children going on to develop anxiety disorders. And again, the longer the ADHD goes unmanaged, this risk increases. By about 30, this risk can be as high as 45%, almost doubling from childhood. Depression seen in about 15 to 25% of ADHD cases. And with that, an increase in suicidal thinking. And it's really important to note that the combination of suicidal thinking plus impulsivity increases the risk for attempting suicide. Learning disabilities, about 35 to 55% of kids also diagnosed with learning disability, sleep disorders, and about 40%. Some of this is due to bedtime routine and behavior problems, but a lot of this is also insomnia, delayed sleep onset, frequent night waking, sleep apnea. We also see substance use disorders and tic disorders and Tourette syndrome. So let's talk about assessment. Accurately diagnosing ADHD requires comprehensive multimodal assessment that integrates various sources of data to really capture the full scope of functioning. And so you want to do a really good clinical history, gather a lot of medical, developmental, psychosocial history. You want to use rating scales, parent, teacher, self-report rating scales across various settings. There are rating scales for kids too, but it's important to note that children with ADHD often underreport what the people around them are seeing. So you can see a discrepancy there in these self-report scales compared to parents and teachers. There's also cognitive neuropsych testing where you can get a really comprehensive, full picture of where the student's strengths and weaknesses are and rule out other problems. There are more ADHD specific measures like continuous performance tests, and very, very important to observations in different environments. When I used to work in the schools, one of the richest sources of data was my observations of children in different classes. And again, it's important to know that even if you don't, there might be a class the child is interested in or they're excited about, so you might not see the same kind of behavior there. So it's important to get observations in multiple settings, even within school. And again, we know that ADHD where there's ADHD, you will find other disorders too, and so it's important to rule out other diagnoses as well. All right, let's talk about treatment, starting with medication. So we have stimulants, short-acting medication is the first line of treatment and highly effective for managing symptoms. Short-acting stimulants, long-acting stimulants, a lot of the time the long-acting stimulants can be preferred because then you don't have to remember to take a second one if you need it, and there's less abuse potential. Then you have the non-stimulant medications like Strattera, Intuitive, for people who don't tolerate kind of stimulant medications or if if they're not working there. Okay, let's talk about some strategies for setting children up for success at home and at school. Because ADHD is a performance disorder, again, a problem with doing what you know, parents and teachers will have to support kids and modify the environment to set them up for success. Let's talk about some concrete strategies here. So first, consistent, you want to externalize motivation. Consistent, positive reinforcement. You must have external consequences, including tangible rewards that are given frequently and close to the behavior you want to reinforce, close in time to the behavior you want to reinforce. You want to provide immediate and frequent feedback, redirection, rewards before punishment, and you want to change the rewards periodically to keep them reinforcing. A lot of parents and teachers use rewards menus where they collaboratively decide with children which rewards are worth what and which ones will work. You want to increase, you can use a token or a point system where points are used to then shop, and again, allow as much access as possible. If the child has a token economy, you don't want to just provide the reward on Fridays. You want to do it every day and even throughout the day. And you want to make rewards worth more points than the taking away of points for misbehaving if you're also doing that. There is this system called that uses tones or musical notes on a variable interval schedules, meaning that so in schools, if you have the whole class, every time the class hears a tone, they write down on a paper whether they were on task or off task while the teacher monitors to make sure they don't cheat. And this is found to be effective in keeping kids on task and with work productivity. You want to plan. Be proactive, not reactive. You want to anticipate roadblocks and challenges for children and help them prepare. Are you going to a mall, store? Are you at schools? A child going from a highly structured setting to a less structured setting? Russell Barkley talks about transition planning. What are the steps? So if you're going to a store, stop before you enter, identify the rules, stay by me, hold my hand when I ask you to, have the child repeat back. Explain the reward or the incentive, and then explain the punishment as well. Have the child repeat it back. You want to deliver the punishment swiftly, not harshly. And when you enter the setting, give them something to do, whether it's checking off items on a list to be bought, whether it's a toy to occupy them. And then you want to enter immediately after reviewing this and follow your plan. You want to get frequent feedback, relevant rewards during the trip, and then at the end, evaluate how it went. Also with planning, you want to break tasks down into smaller steps. And we'll talk about time later, but smaller steps with time limits. So if you're writing a paper, step 1, brainstorm for 10 minutes. Step 2, write the intro paragraph for 15 minutes. And doing this can increase task completion. Working memory. Communication will be really important for this. Shorten your message. Use less words. Use more physical contact when appropriate. Put your hand around the arm around the child. Put your hand on their arm in an affectionate way to get their attention. Eye contact. Briefly say what you want. Is it an instruction, reminder, praise, or a reprimand? Again, check for understanding. Have the child repeat back. If it's a step, a few steps or a list of things that you want that child to do, give them that list written down. And you want to offload the contents of working memory onto external devices in the child's visual field in a clear and organized way. What are they doing? What are the steps? Again, you want to incorporate visual checklists, and you want to don't forget, always check for understanding regularly to ensure that the child is on track. Organization and daily routine challenges. So organizing personal spaces. You want to organize personal spaces with labeled bins. You want designated work areas, labeled pencils, paper, books, color coordinate folders and supplies. You want for homework, you want structured homework routines by establish a distraction-free workspace, and fixed study times can improve the likelihood that kids will do their homework. There's also a technique that I like used with older kids and adults called the parking lot technique, where if you find that if you're working on one thing and you have a good unrelated idea, you kind of park it, you write it down so that you don't forget it later, but that you still have a chance on coming back to what you just got distracted from with that idea. Scaffolding is very important, providing guided assistance while gradually promoting independence, and is helpful for success, academic success, homework completion, setting smaller goals and supporting and reaching them. For example, if there's 30 math problems on a page, let's do the first 5 math problems together. Using timers and checklists. We also want to externalize time. Give children a sense of time and what they should be doing with that time. As we discussed already, you want to bring consequences closer to behavior to make the rewards more effective, and keep the time. So there's a lot, the timers where you turn on, you can see the red getting smaller and smaller. So you use that, make the time visual and present as the children are working. For for self-regulation, emotion regulation, you want to teach children and model what it looks like to check in with themselves. How are you feeling and what are you doing? What is your body doing? Depending on the age of the child, you can use one word to cue a student to do this. You want to have a chill out corner. You want to allow students to take a break. There's also a strategy that teachers can use in classrooms where rather than students raising their hand if they have the right answer, they all write it down. And this will help assess for the knowledge rather than just one child's knowledge, and it will also discourage impulsive responding. For sustaining attention and focus, you want to engage multiple senses in students with ADHD, visual, auditory, hands-on activities. You want to use videos, experiments, interactive group things, and you want to allow students to move around the classroom and to be as animated as possible if you are their teacher. For sleep disruptions, you want to have consistent sleep routines. Be careful with the timing of stimulants. If they're given too late in the day, it might interfere. And then with screen time. So when kids with ADHD sometimes struggle going from an activity that's highly stimulating, like screen time or video games, to then very low, so like now nothing. So you might want to have like a step down approach there, or stop screens in the hour to 2 before bedtime. Now I want to talk about classroom accommodations and differentiate between instructional strategies and classroom accommodations and modifications. One is what you do as a teacher or a parent, and the other are the changes you make to the child's environment, and both are required to support students with ADHD. So first we have preferential seating in the classroom. This is a very effective modification. You want to sit the student near the teacher or away from distractions so they can stay focused and get the support they need more easily, like redirection. And it's also easier to provide immediate consequences the closer the child is to the teacher. The individual desks are better for kids with ADHD than those kind of like group desks where they're like 6 people facing each other. You want to use flexible seating and movement breaks. Standing desks, allowing students to choose a seating arrangement that supports focus. So I'm thinking about a teacher that I worked with, and a child was falling out of their chair several times a day. And so, and the teacher suggested giving them like a fidget to hold. And I said, well, wait, let's take a look at like the sensor, what's actually happening. Child's pushing with their feet. Maybe a band around the chair would be more helpful. Since the implementation of that, that child has not fallen out of their chair in months. You want to allow, again, movement during lessons. Simple and repetitive movements like squeezing a ball or doodling can help children with ADHD attend better to what's going on around them. And you want to involve them in the lesson as much as possible. Let them change the slide as you teach, hold the pointer as you teach, things like that. And also important is to not punish a child by taking away gym or recess, or pull them for services during that time, because that movement time is very important for children with ADHD. So extended time, yeah, I guess maybe this reduces the pressure, but the research talks more about the research supports more breaks during tests. So not more actual test time, but pausing the clock during a test, taking a movement break, and then continuing the test. So not exactly extended time, just flexible time. Again, graphic organizers, visual aids, multisensory approach here. And you also want to reduce the workload when necessary. Kids with ADHD have bigger problems with productivity over accuracy. Accuracy might not be great, but the bigger problem is with being productive. And so when school starts or in the beginning of the school year, you want to reward productivity often and focus on that first. And if there's, again, we talked about this already, a problem of 30 math problems on a page, either reduce the workload or do 5 at a time, take a break, come back. There are some good strategies for reading. I won't go into it too much, but it's called the SQ4R method. It stands for survey, question, read, reflect, recite, review, and it's an active reading technique designed to improve comprehension and retention. In school, the scheduling of classes is important. You want to schedule more difficult subjects in the morning as attention span declines throughout the day. And you also may want to alternate challenging classes with easier classes. For teens, having a mentor or a coach throughout the day can be helpful. 5-minute check-ins and a morning, lunch, afternoon. And yeah, okay. Let's talk about parent management training programs. There's a lot of really good evidence out there to support these training programs. And while there are a lot of different ones out there, they kind of share the same ingredients and goals, which are to understand and accept children with ADHD. They focus on increasing positive attention, reducing oppositional disruptive behaviors, strengthening parent-child relationships, decreasing parental stress, and very importantly, home-school collaboration. And so here I will talk about, here's a list of some evidence-based parent training management programs. And I'll talk a little bit about PCIT. Parent-child interaction therapy is a program designed to be 12 to 20 sessions, and it's implemented in 2 phases. And this therapy is unique in that it involves live coaching sessions. So parents wear an earpiece. They wear an earpiece and they receive real-time feedback through a one-way mirror or video call while the therapist observes interactions with the child and then provides immediate coaching on how to respond to behaviors. There's 2 phases here. You have the CDI and the PDI phase. During the CDI phase, or child-directed interaction, the goal is to strengthen the parent-child bond. And so there, they use something called PRIDE skills: praise, reflect, imitate, describe, and enthusiasm, to foster a warm and supportive relationship. And during this phase, parents avoid commands, questions, criticism, focus only on positive reinforcement and active engagement in play. And so, for example, if you see a child building with blocks, coached parent might say, "I love how carefully you're stacking those blocks." Second phase, PDI, or parent-directed interaction. Parents learn here to give clear, consistent commands, following specific guidelines, and then following through with consequences. So here you have direct commands. That guidelines are direct commands, positively stated, one at a time, specific, developmentally appropriate, tone of voice, explanation or reason, and then only when necessary. And so here the focus is effective discipline strategies. And so one example of this is the way you phrase things. So is it time? It's time to leave for school. Put your shoes on versus can you put your shoes on? And like any therapy, the most important part is the in-between. Therapy is like learning a new language. Yes, you'll learn something if you go week to week, but without the consistent practice every day, you are likely not to master that new language. Another quick example, the Incredible Years. This is more in a group format, starts with babies 0 to 12 months, goes up to 6 to 12 years. This one is 14 to 20 sessions, 8 to 12 parents per group. And again, like I said, similar ingredients here. Let's take a look at some evidence-based programs for managing ADHD at school. And as you see, something looks similar here. So these same programs, the Incredible Years, PCIT, they are modified for use in the classrooms. And so again, one of the most important things or ingredients in success of children with ADHD is the home school collaboration, interventions, modifications in all environments. And so the daily report card program is one way to increase that homeschool collaboration and that homeschool partnership. And so the daily report card is a structured behavior chart where teachers, they complete the chart at the end of each class, and then the student takes it home. It's important that you spend time with these goals, that they're explicit, targeted behavior goals. And so if you get following rules, you can specify which rule, raising hand, turning in assignments, and then the teacher rates how well the student did using number ratings. And then the student takes this home, reviews it with parents, and then chooses which reward. And again, as we've already discussed, choosing effective rewards is very, very important. It's important also to check in with teachers, not just, in addition to this, not just at the end of the marking period. So you want to be checking in often on purpose and increasing collaboration. So let's talk a little bit about accommodations and special education. So we've already been talking about accommodations. A 504 plan is a way to formalize these accommodations in schools. This is a plan designed to ensure that students with disabilities have equal access to learning. It's civil rights law. And so what you typically see on these 504 plans, so it's typically for students that don't require specialized instruction, but do need accommodations to help them succeed in the general education setting. And so on there, you might see things like preferential seating, modified assignments, movement breaks, things like that. An IEP, on the other hand, it provides both accommodations and specialized instruction for students whose disability significantly impacts their learning. IEPs are covered under the Individuals with Disabilities Education Act and its federal special education law. And so here you might see more programmatic changes related services like counseling. The program changes might be things like less children in the classroom, smaller ratios, pull-out services like a resource room or like a co-teaching environment where you might have 2 teachers in the room. Things like that really help students with ADHD as well. So, and let's look at one more thing here, individual therapy. In children, there really isn't much evidence to support the use of individual therapy in children. The older you get, the more effective it can be. Things like CBT for adolescents start to become useful, work on coping skills, frustration tolerance, emotion regulation, and things like motivational interviewing can also be helpful if teens are struggling with taking their medication or following through on taking their medication. And again, as we discussed, you start to see those co-occurring disorders emerge. And so CBT and therapy is helpful with that. In adults, CBT is most helpful, and things like CBT, acceptance and commitment therapy, mindfulness-based therapies have been shown to improve some ADHD-related stress, any co-occurring disorders, and there a lot of people work on like executive functioning coaching and just figuring out ways, tips, tricks, strategies to modify their own environments and create for success. Exercise. So the evidence does show benefits for teens and kids when it comes to exercise. The exercise should be routine, cardio. That shows the most benefit to children with ADHD. Okay, let's go ahead and bring this all together. So ADHD, as you see, is not just a childhood disorder. It is a lifelong challenge that can impact many areas of functioning. Early diagnosis and intervention lead to much better long-term outcomes. And managing and treating ADHD requires a comprehensive approach, again, including medication management, environmental changes and accommodations, parent training, school intervention, and depending on age, possibly therapy. And as if I haven't said this enough times, beyond treatment and strategies, understanding, acceptance, and compassion are essential when it comes to ADHD and then treating it. And so here, just very quickly, we'll take a look at some resources. Russell Barkley's YouTube channel is excellent, and he does even like a research update every week. And so it's a very good way to also stay up to date on what's out there. And some of these books are excellent. A lot of them I pulled from for the presentation today. A lot of good tips, a lot of good information. So highly recommended. And that's all, folks.
All right, well, thank you, Jennifer. We did have a couple of questions come in. The first one is about, can you talk a little bit about the rigidity aspect that can occur with ADHD? I diagnose autism and have gotten quite a few referrals for ADHD kiddos who consistently do not meet ASD criteria, mainly referred because they are rigid in routines and interests. Does this rigidity relate to the overall executive functioning?
Yes, it can. So again, just to review, I think it was 20%, right? I think about 20% of kids that are diagnosed with ADHD first are then diagnosed with autism. And it's important to note that when the autism tends to be more mild when it is diagnosed there. So that's number one. Number two, the rigidity. We talked about cognitive flexibility and switching, and that is absolutely one of the executive functioning areas. And so you see a lot of kind of stuckness in, so think about it. It's rigidity it's difficulty transitioning. It's you thought you'd be doing something, but then now you have to switch your attention, regulate your emotions, and be able to then initiate, organize, and plan this new thing that you're doing. And so, yes, we definitely see that as well. And you do see a lot of rigidity as well. I think there's an overlap there.
Thank you. All right,
Answer
another
your
question. I hope so. If not, if that was your question, just feel free to post another question for follow-up. Another question is, how would treatment be different for a child who has ADHD versus a child who have multiple diagnoses?
Depends what's most impairing. And so you are likely to see co-occurring disorders, especially the older the child gets. I'll tell you, so specifically with the research with depression and ADHD, you want to treat the ADHD first. You want to decrease that impulsivity, unless the depression is what's most impairing. So you treat what's most impairing first. A lot of the time, it depends. Yeah, it's difficult to give a clear answer there because I think the standard should be what is most impairing. And again, the ADHD does impair so much, and so a lot of the time you see even when people start medication or something like that, the other symptoms start to decrease.
We have one more. My child has ADHD but doesn't have any of the classroom accommodations. What should I do?
Um, That depends. Your child might have ADHD and not need any classroom accommodations. Again, the mild, moderate, severe, it depends how the ADHD is manifesting itself in your child's classroom. And so you can look at several things. You can look at grades, you can consult with your teachers, depending on the age of your child. Well, either way, you should talk to your child in a developmentally appropriate way. But ADHD doesn't mean that you need accommodations, but accommodations are an effective way to treat the difficulties that come along with ADHD. That answers your question.
Perfect. All right. Well, that is all that I see that has come in thus far. Again, if you do have any questions, just feel free to post it in the Q&A or in the chat. Or if you have any questions that you think of after we do end today's presentation, just feel free to email us at professionaldevelopment@manhattanpsychologygroup.com, and then we can connect you on with Jennifer. But thank you so much, Jennifer, and thank you everyone for joining us today. This is the end of today's presentation, but I will stay on for a few extra minutes to support with any CE questions that you might have. Jennifer, you're welcome
Okay,
to stay
great.
on if you would like to, but you don't have to.
Sure. I can stay on for a few minutes if there are any more lingering questions.